I'm so glad you agreed to do this. Thank you.
Yep. I'd do anything for you.
Oh, thank you, Mr. Lapinto. Appreciate it. Okay, so we've been on like a 10-year journey.
Yep.
With
It's
your
been a
headaches.
long journey, some ups and downs.
Yeah, ups and downs and reversals.
Yep. So.
And now we give thanks.
Yep.
Because you're doing great.
I know. I think it's awesome.
Yeah. So let's start. What was it like when you first came to me like 10 years ago?
Ooh, it was rough. I couldn't even function. I was barely working my job, and definitely was no part of my family's life. So, it was a lot of desperation, a lot of depression.
Yeah. So. And what was bothering you the most at that time?
Probably was the migraines.
Mm-hmm. Yeah. Were you having a lot of headache when neck pain when we first got started?
Yeah, there was some neck pain, not as severe as it became.
Yeah.
But mostly it was the migraines.
Yeah. So in those first years, did we get control of that with medicines?
No, I think the injections, we did the radio frequencies.
Right.
That's how we got control of the neck pain.
Right. And that helped your headaches, right?
A little bit, yep.
Yeah, so we did the test blocks in your neck, and then we burned those nerves that form up the back of the head.
Yep.
And that was to take care of the part of the headaches that came from the neck.
Correct.
Okay, but now I know multiple members of your family, and I know that you have a strong family history of migraine.
Yep. Now my daughter's been suffering from them, so.
Yeah. Right, so then there was the part that's hereditary. I have it too. And then the part that came from your neck.
Yes, correct.
So then we got control at that time with the injections and some light medicine. And then how do you remember it going from there?
Then I just think my neck pain just got to an too extreme, and then we did some MRIs, some imaging, and we found out that I needed the fusion in my neck.
Right. So we got those imaging, and it had gotten a lot worse.
Yeah. And
it was clear to me you needed a pretty big surgery.
Yep.
And that happened. And how did that go?
That went well for about 3-4 months, I guess. And then slowly but surely, not so much the neck pain, but the headaches started coming back.
Yeah. Yeah.
So, but the neck pains kind of went away, but we still had to go back and do some radio frequencies after the fusion.
Yeah. And it was that during the time where I did the blocks up your nose, the spinopalatal ganglion blocks up your nose. Yeah. And we tried the cephaly that goes on your head. And we tried the vagus nerve stimulator.
Yep.
Yeah.
I think we've tried everything in a book.
Yeah. Yeah. Absolutely. So then I think I remember it re-escalating again.
Yeah.
Is that what you remember?
Mm-hmm.
Tell me about that.
So it just out of the blue, it just started getting worse, progressively worse and worse. And then, it came to, all to a head. I just couldn't take it anymore. We had to go in a different direction.
Yeah.
And I think I approached Kelly about some place up in Texas.
Yeah.
But I want to talk to you about it because I wasn't going to do anything without your advice or, your consent or anything.
Yeah.
And then that's when the process started with the spinal cord stimulator.
Right. So what I remember is you were thinking about having a very big procedure in the front and back of your head that wasn't covered by insurance. And I was concerned about that because it's not just of course I want you to feel better, but your financial well-being is important too.
Yep.
And so what I remember is that when you went back to the surgeon, maybe there was a problem with one of the levels being fused.
Yeah, the top one didn't all the way heal correctly.
Yeah. Right.
So, I still see one of the doctors in their office and he takes care of it.
Yeah.
Like he just looks at it basically and makes sure if I start having pain, then he's going to want to go back, he said. But if I'm not having any severe pain or anything, to not worry with it is, to bother with it right now.
Yeah. So then this is when I proposed a spinal cord stimulator in the neck.
Yep.
Right. And tell me about that process from your viewpoint. How did that go?
It wasn't easy, but you and your staff worked so hard to get the insurance to go through it. We had to go see a bunch of doctors. I can't remember how many different doctors to see if that was the best option.
Right.
And, and if, I think I saw 2 or 3.
Yeah.
One wasn't sure, but he said, go see this other guy. And then he finally said, let's give it a try.
Yeah, so I was disappointed because we did all this stuff. We have to get neuropsyche valves to show you're okay with an implantable device.
And I forgot about that. I had to do that over the phone.
Yeah, and then we had the denial of the procedure by the insurance company, and I really felt so disappointed.
Yeah.
That we were able to, push and continue and get that through.
Yeah, and I'm thankful. I know your staff. Y'all did an awesome job of staying on the insurance to make sure it happened for me.
Yeah. So that was good. We got it through. So then we did the trial.
Yep. The trial went fabulous.
Yeah.
So.
Very encouraging.
Yep.
So then we got the implant.
And everything healed well.
Yeah.
Just,
Yeah. And so you
can't be more happier than
me either, because what'd you tell me when you came in here today?
Oh, I think I've had 3 migraines. One was my fault because I left my remote control and couldn't do anything with it. But basically, it's been a lifesaver.
Yeah. So you're back to coach because you're a coach.
Yep.
And I just love it that you're coaching the kids.
Yep.
Because you're a wonderful role model.
Yeah. So,
for the kids.
And then I'm getting to spend time more with my family, and that's huge.
It's huge.
Yep.
Because having pain, I mean, we don't want to talk and do things.
No.
Yeah.
So it was a tough road, but it's
a lot of ups and downs.
Yep.
Because from my viewpoint, like, we got control, and then something happened, we lost it. Got it again, lost it. And I mean, I even escalated through Vyepti, like the most, fancy drugs we have. And then
we
finally,
tried almost everything that came on the market new.
Right.
We tried it, and we had some good results, and then sometimes it fell back, like you said.
Yeah, and I mean, our body changes over time, and things change, and so then, you change, stuff happen, right? Like it does for us all. And so, but I'm just so thankful.
Yeah, me too.
Yeah. Yes, and I just want to thank you for.
Oh, I want to thank you.
And,
and your staff.
Makes me happy.
I knew I was in the right place 10 years ago, whatever it was, but now I knew I was here. I tell people that all the time.
Yeah. Well, all right. Thank you so much, and I'll be seeing you soon.